This segment is sponsored by the Prince George's County Department of Health. They urge everyone to consider getting a COVID-19 vaccine when they become more readily available. I spoke to the health officer of Prince George's County, Dr. Ernest Carter. Dr. Carter, thank you so much for joining us today for Great Day Washington and talking about these vaccinations. First of all, what do you say to people who think that this vaccine is new?
Well, coronavirus is not new. It's been studied for a long time, and there's been a lot of development around it, especially as it came to fruition. So right now, I think that people should know that there have been all of the trials that have been out there, the clinical trials that have been very carefully studied. And right now, with the FDA approving it, those boards really scrutinized it very heavily to understand that this vaccination is safe, and it's been very well studied.
Well, why is it so important for people to get vaccinated?
The most important thing to remember is that if you get vaccinated, then you are protected. And not only are you protected, but you're going to protect other people, because the more people that get vaccinated, the more it allows the people who are not vaccinated not to get exposed to the COVID virus. And if we get to a certain number of vaccinations, which typically is what they call herd immunity, then we actually crush the virus's spread. So that's the importance of receiving a vaccine. It's very important for us to stop this spread.
Well, as this is rolling out to the public too, we understand it's happening in phases. So what phase are we in right now? Like, who is currently receiving this vaccine, and why that group?
Well, we're currently in phase 1A, and that's all of the healthcare providers. That's people in nursing homes, people who have a very high risk of being in a conjugate living facility, like in a senior center. And those folks, as well as all of the vaccinators, those are the people who need to be vaccinated first. And that's phase 1A.
All right, then after that, what would the next phase be? And maybe when do you think we'll actually move into that phase?
Well, the next phase would be phase 1B. And in phase 1B, that's when we start to vaccinate folks who are at high risk for getting COVID and having significant illness from it, because they have a significant illness themselves. It'll take weeks to almost months before we can get really into phase 1B. Hopefully we can get through phase 1A within weeks. Sometimes it may take longer, depending on how the distribution of the vaccination, how fast we get the vaccine.
Wow. So it sounds like we all need to have patience in this process, right? For people who have come up to you and say, I'm a little apprehensive about taking this vaccine, what do you say to them?
This vaccine was developed in a way that doesn't give you the live vaccine. It only gives you a small piece that you need to develop immunity. So I want people to understand that this is a safe vaccine. I've gotten it, and it will definitely help you get immunized and become safe.
Dr. Carter, thank you so much for your time today, helping us get the message out. Anything you want to leave people with?
I want them to know that the sooner they get vaccinated, the sooner we'll all get protected. It's really important. It'll protect our loved ones. It'll help us get back to the point where our restaurants get open and we can get back to some semblance of normal.
And Dr. Carter also stresses that even after getting the vaccine, we must continue to practice personal safety and make smart decisions by wearing our mask, keeping 6 feet apart from others, washing our hands, and limiting our gatherings to people that are just in our household. Be proud to be protected.